Hi, my name is Dr. Luis Garcia, and I am a general surgeon here at the University of Iowa Hospitals and Clinics. I take care of trauma patients, general surgery patients, and I am board certified as well in critical care medicine, so I spend some of my time in the intensive care unit. From a general surgery standpoint, I have an interest in caring for patients with complex abdominal hernias, and today I'll briefly go over how we fix a hernia and briefly go over some of the more advanced techniques that we offer here at the University of Iowa Hospitals and Clinics called component separation. If we look at the diagram on the board here, we see what's a typical scenario for a patient with a hernia in which the abdominal muscles are separated and there's a bulge that the patient usually presents with. Now, one of the key components of fixing an abdominal hernia is to be able to get these muscles and sew them back together in the middle. And what that helps us do is restore the function of the abdominal wall for the patient. Now, depending on the size of the hernia, sometimes we can do this pretty easily by just sewing the muscles back together. But patients with larger hernias, or maybe patients that have had previous hernia repairs, that may not be possible. And if that's the case, we do what's called a component separation. And all a component separation is that we cut certain parts of the abdominal wall that separates the different components, and it allows us to move these muscles back together in the middle. If we look at the diagram here, what we've shown is that some of these layers have been cut during surgery, and that we've been able to get the muscles back together in the middle. So to recap, some of the key points when fixing an abdominal hernia is that you must get the muscles back together in the middle. This allows for the function of the abdominal wall to be restored, leading to optimal outcomes for the patient. And depending on the size of the hernia and the number of previous hernia repairs that the patient has had, it may require more complex procedures such as a component separation. If you have any questions, please feel free to call me at the University of Iowa Hospitals and Clinics, and I would be happy to answer your questions about hernias. There is nothing routine about hernia surgery, and that is why we have a dedicated team of surgeons from multiple specialties to ensure that the best treatment and care are provided to our patients.